What is up, plebes? In this video, I'll be discussing exactly how I implemented my study techniques to study for my clinical skills class. This one's kind of different because it's a lot of hands-on stuff, so stay tuned if that interests you. All right, guys. Hi, my name is Mario Navarro. I'm a second-year PA student at UC Davis in Sacramento, California. Today, I'm going to be discussing exactly how I studied for my clinical skills course. To kind of summarize it, this course is really teaching you and building a toolkit to diagnose and to use the common tools that you see at your medical provider's office. So things like a reflex hammer, like a stethoscope, like the otoscope, like an ophthalmoscope. We learn how to use it in this class. The first thing I want to discuss, and for this one, I don't really have much of a PowerPoint presentation. I'm just going to be talking to you guys, is the fact that this class is very, very hands-on. And one thing that you guys want to keep in mind is that practice makes perfect. I'll say it again, practice makes perfect. So the more times that you can practice, listening to the lungs, listening to the heart, or looking in the ear, it's going to make you better. And so again, I've said it before, and I've probably drilled this into your guys' brains, is we need to practice like we play. Most programs will give you some form of rubric or guidance as to what they expect you to do when you walk into a room and have to do a physical exam. And so I actually do have the rubric that we use here at UC Davis. I'll show it to you guys briefly so you get an idea of what that looks like. And if your school doesn't provide it to you, you should ask them for it. Because again, it's just going to help you be a better provider. It's going to help you have a systematic flow so that, again, you know exactly what's expected of you and so you can do well in this course. Here we have our rubric, and this was the rubric that we used for our physical exams. And so as you can see here, we would always start our exam with our skin and general signs. So introduce yourself. Hi, my name is Mario Navarro. I'm one of the PA students working at this clinic. Are you in a comfortable position right now? As you're washing your hands, and then you comment on the general appearance. Patient appears well-groomed, well-nourished, and no visible distress. Appears to be, stated age. And then you approach the patient, you palpate their radial pulses, assess their pulse rate for 15 seconds, respiratory rate for 30 seconds. And if you notice in bold, it tells you need to verbalize these to the patient because it's always important to keep the patient in the loop as to what their vital signs are. And so, I'm not going to go through it all because it would take too long. But as you can see here, we essentially have everything that we're expected to do in terms of looking in the eyes, inspecting external eye structures, assessing the visual acuity with an eye chart, testing visual fields by confrontation. Additional tip that I have for this specific type of assessment where you have to run through a physical exam is type out somewhere, maybe on like a Google Doc, write out what exactly you're going to verbalize and memorize that. That way you don't have to be thinking or fumbling when you're, looking in the ear. You don't want to be thinking like, tympanic membrane is normal. No, you want to be able to go in there, look inside the ear, and immediately say tympanic membrane is intact, pearly gray in color, no retractions, bony landmarks visible, cone of light present. Like that should just roll off your tongue, and you don't have to think about it. The next thing I want to talk about are SOAP notes. SOAP stands for Subjective, Objective, Assessment, and Plan. And so these are the notes that we are responsible for writing as providers. And this is how you document what you did. The subjective part is the actual patient interview, what the patient tells you. The objective is actual findings, things like vital signs, things like you listening to the lung sounds. These are objective, factual findings. Not to say that what the patient is saying isn't factual, but these are the stuff that you do, that you see, that you hear with your own ears and eyes, and the blood pressure, the heart rate, all of those things are going to be in your objective findings. The assessment is where you actually put all of those findings together and you come up with what we call a differential diagnosis. This is where you write out, this patient has this finding, X finding, Y finding, and Z finding. And because of all these findings, my most likely diagnosis is a certain heart condition or is a certain skin infection. And so that's what you do in your assessment. And then the actual plan is where you dive into what interventions you want to do. If you want to admit the patient, if you want to start medications, if you want to start fluids, if you want to do a consult with another provider, and when to follow up. And so that's essentially in brief what the SOAP note is. Tip for this is ask your professors for examples or upperclassmen. Usually, your upperclassmen have written multiple SOAP notes. And usually, at least at our program, our faculty would give us a mock SOAP note that they wrote for us to kind of guide our writing and have, what is the standard for the SOAP note, what that should look like. Now I want to move into talking about simulated patient encounters. In some schools, this is called an OSCE, which is an objective simulated clinical examination. Essentially what this is the school will hire an actor. And this is kind of, if you haven't seen my video about, a day in the life as a physician associate student, the beginning of that video is me going to school to do a simulated patient encounter. And what we essentially do is we are in a low stakes environment where we have to do the things that providers do, but with an actor.
And are you experiencing any discomfort?
Just a little burning during urination.
Okay. Any other pain?
The haunting memories of lost love.
They act out all of the emotions, all of the, if they're in pain, they're, groaning, and you have to empathize. You have to do your assessment in a quick and timely manner under timed conditions. Yeah, some advice that I have for that is to practice practice with your classmates. I would routinely practice with Brian, especially if we were doing just a patient interview, no physical exam, just a patient interview. We would hop on Zoom, and depending on the block, typically if we were learning, let's say like cardiology, our clinical skills course, they would give us a chief complaint, or we knew that our simulated patient was going to be having a potentially cardiology related complaint. And so practice with your classmate, but also practice based on the potential topic that you may think, because it's going to get you in the motion of asking the appropriate questions. And the questions that you ask for, someone who broke their leg aren't going to be the same questions that you ask for someone who's been having a productive cough. And so the more you can practice under time conditions with a classmate and practice on a similar topic that you think will be tested, the better off you'll be. Last thing is quizzes and exams. For this, from my own experience, we would have about 2 to 3 exams for our clinical skills course. We would be tested on the material from lecture. And so what I did is I approached this how I approached my pharmacology class. I would pay attention in class and jot down what I didn't need to know, what was high yield. I converted the high yield, not every slide. I just converted the ones that I thought were very important into Anki and memorized that. And that allowed me to be successful on my quizzes and exams. All right, guys, that is it for this video. I appreciate you guys staying to the end. If you found this content helpful, go ahead and give this video a like, subscribe, comment down below if you have any other questions. I'm here for you guys. Again, Animo, and we have one more video left where I'll be discussing some study myths that I've been seeing on social media, and I hope to help you guys get a better understanding and essentially learn about learning. Saludos, amigos, and thank you for the support.